This is Dr. Roger Knapp, a pediatrician. I'd like to talk to you about stomach aches. And now I'm talking about mostly grade school age kids. We tend to see quite a bit of stomach aches during grade school years. I think it's because they can't use restroom facilities when they need to, and they tend to hold on until they get home. So mild constipation is a common cause. But the question comes up when your child's crying with a stomach ache on a Saturday night. It's always on Saturday night. And you wonder, is this appendicitis? Do I need to take him into the emergency room? Or is this just a bad stomach cramp? I can wait and see if it lasts or see the doctor later. And the good test for this, typically a parent will push on the child's stomach and they say, ow, and you don't know anything. And we can tell because we've been doing it 100 years. Not too many parents can figure it out by pushing on their stomach. And where it hurts doesn't necessarily help you, because sometimes appendicitis early on can be more in the middle before it moves over to the right. So the location doesn't help you very much. Anything that jiggles the intestines will cause pain when there's serious abdominal infections such as appendicitis. And it's fairly similar to someone who's had an operation, C-section, or even when you had the baby. When that person coughs, boy, you can tell it hurts. You don't have to ask them. They go, and they end up with a wince on their face, and they tend to give in a little bit or wince. And that's a good sign that hurt their stomach. You don't have to ask them. So anything that jiggles the stomach will cause that. So the best thing to do is ask your child when they're crying with a stomach ache to have them take a big breath and cough. And that cough jiggles the stomach, and just don't ask them, does it hurt? Just watch them. You don't ask them. And you'll see it on their face, or they'll kind of wince. Some of the surgeons will actually have them hop and watch their reaction. And actually, as they climb off of our exam table, it's part of our exam, watching them as they jump off of the table. The other is when they're lying flat on the couch, just tap on the bottom of their foot, and that jiggles their whole body and their intestines. And if they grab their stomach and say, ow, when you tap on their foot, then you need to take them into the emergency room. You got trouble. May not be appendicitis, but that's enough pain where we should be seeing them. More serious infection causes of stomach aches. They cause diarrhea, blood in their stools, 5-pound weight loss. But there's a few other causes of stomach aches that might want to zip through that are more common causes. There are other causes of stomach aches, but these are what I think are common. One is constipation, and we treat that with Miralax, and there's an article and video on constipation that I put out. The other cause for that is they have now become allergic to some kind of food, milk, lactose intolerance to the milk. 10% of the population become lactose tolerant every 10 years of life. 20% are having problems by 20 years of age, 30% by 30 years of age. So at any point in time, we can become allergic or lose that tolerance to lactose at any age, at any point in time. But parents get caught in the trap of saying, well, gosh, they couldn't be having problems with their breakfast cereal. We've been giving them that for years. Well, they may now have problems with it. So something in their diet. It's really easy just to go 2 or 3 days without any food group. So eliminate vegetables for 2 or 3 days. No problem there. Put them back in the diet. Eliminate all the dairy products for a few days, put them back in. Eliminate all the meats and fruits and juices. And that way you can kind of tell, is there anything in their diet bothering them fairly quickly. It's usually pretty fast. The other cause for stomach aches is celiac disease. It's an allergy to gluten, which is in wheat. I think that's become real popular. I think there's a lot of people saying that they're gluten intolerant when they're really not. But if it causes them to eat a little healthier and it does improve symptoms, then it's probably worth it. But very few people are actually allergic to the gluten. And we can actually run blood work to detect that. The other cause for stomach pain is bacteria that infects the lining of the stomach called H. pylori. And that bacteria infects the lining of the stomach and actually can cause ulcers in older people. We used to think ulcers were caused from stress and the acid, but that was secondary. The primary problem was actually a bacterial infection in the stomach. And there's tests for this H. pylori germ, but it'll cause a lot of stomach aches for quite a while. Obviously, if there's other symptoms, diarrhea, vomiting, other symptoms, then you need, of course, get in touch with a doctor. There's other causes for stomach aches. Well, that's a kind of a general rundown on, do I need to take them in the emergency room on stomach aches? Appreciate your listening. This is Dr. Roger Knapp.